Hi, good evening. Good evening, everyone. I'm so happy to be here today with Parent Academy. My name is Jonisha Addison. I am a school behavior health, mental health specialist in the Department of School Behavior Health, which is a sub department in the Student Support and Discipline Services here at Duval County Public Schools. So I'm going to go ahead and share my screen so that we can get started. Tonight's presentation is going to focus on healthy minds, healthy students. So here at Duval County, as I said, we are the Department of School Behavior Health, and our focus is to really ensure that students receive mental health resources in our classrooms each and every day. And we do this in various ways. Tonight's presentation will give you just some insight on what it is that we at Duval County Public Schools do. So our agenda. First, we will go through a mental health overview, and then we'll focus on mental health in DCPS and how it impacts our students here in DCPS. Then we will talk about how DCPS addresses mental health, the things that we do to address students' mental health and ensure their well being each and every day. And then lastly, we'll focus on what parents can do, which is what you all as parents can do to ensure that your students are receiving adequate services, not just at school, but in the home as well. So here is a quick video, and this video just gives some insight on physical illness versus mental illness. I believe I included the computer sound, so you all should hear it. So here we go.
Have you ever broken a bone? What did you do? You went to the doctor to get an x ray, and they put your arm in a cast. Breaking a bone is common, and nobody told you to just snap out of it, as if you could control whether or not it was broken. How about when you are sick with a fever? You go to the doctor and they prescribe you medicine that makes you feel better. No matter how hard you try, you can't use the power of the mind to mend bones or cure sickness. Everybody knows that. But there are some illnesses that you cannot see: mental illnesses, illnesses in the brain. No different from a broken arm or a sore throat, other than the fact that they cannot be seen because they are inside your head. Like a dysfunctioning traffic light turning the wrong color and messing up traffic, mental illnesses are caused by chemical imbalances in the brain causing certain signals to be disrupted. A common example of mental illness is depression, which is when someone feels sad almost all of the time, even if they are in a happy environment. And another example is anxiety, which is when someone feels nervous or scared, even in the calmest of situations. They aren't choosing to feel this way. In fact, they can't control it any more than you could control having a sore throat. And to fix it, they need to go to the doctor too. 1 in 4 people will suffer from a mental illness in their lifetime. The other 3 will have a friend or family member who will. This affects everyone. Just because someone has a mental illness does not mean they are different. They just need to reach out and ask for some help. The bravest person can suffer from anxiety, and the happiest person can suffer from depression. Support friends with mental illness the same way in which you would support a friend with a broken arm. And if you think you have a mental illness, do not be afraid to go to the doctor or talk to a parent. You are not weak, it is not your fault, and you are not alone. There are people all around you with mental illnesses living normal lives. By talking about mental illness and supporting each other, we can heal minds as easily as we heal bones.
All right. So in the chat box, if you could just type in if you know someone who suffers from a mental illness or someone who has ever suffered from a mental health challenge. That's important to know. Type it in the chat box.
We've got a couple people with raising their hands now.
Okay. All right. That's awesome. That's awesome. So we all know someone who may suffer or may have suffered from a mental health diagnosis or mental illness. So these are some facts, and these facts were given to us by the National Alliance on Mental Illness, and we often collaborate with NAMI. We call them NAMI. That's the acronym. We often collaborate with NAMI to bring awareness to suicide prevention within our schools. And what they have is a program called Ending the Silence. So we ensure that students receive this program. It's almost like a 50-minute session where we talk about suicidality and ways to cope and kind of give students some um, just just a little push, just a little nudge, and letting them know that there is always someone that you can talk to, and don't be afraid to speak up if you or someone you know is suffering from a mental illness or suicide. So these are some facts. The facts are at least 1 in 5 children aged 13 through 18 have or will have a serious mental illness, okay? These are just facts. So, in your child's classroom, at least 1 in 5 of those students have or will have a serious mental illness. So, at least 11% of youth have a mood disorder. That is a disorder that affects that student's mood. It affects the way that they may behave, the way that it affects their performance, it inhibits their attendance, just everything that may cause a child to suffer or exhibit just some type of symptoms that are, I wouldn't say abnormal, but they're just different from what other students may deal with. So at least 10% of youth have a behavior or conduct disorder. And behavior or conduct disorder, those disorders consist of ADHD or oppositional defiance. And then at least 11% of youth have an anxiety disorder where they suffer from extreme agitation or just anxiety in general or stress. From it could be from home life, it could be from school, suffering from the workload. We see this disorder in a lot of our students who are at early college schools because the workload is just so high that it could cause anxiety. Not saying that it does, but for some students they do suffer from anxiety and they need extra attention. So these are just some more facts. At least 50% of all lifetime cases of mental illness begin by age 14 and 75% by age 24. Okay? 10 years. The average between the onset of symptoms and intervention is at least 8 to 10 years. So it takes about 10 years for these symptoms to display themselves. 37% of students with a mental health condition at age 14 and older, they drop out of high school. They usually don't make it because remember, it takes about 10 years. So a lot of our students are going undiagnosed. They have no idea that this is something that they're suffering from. Um, and it's the highest dropout rate of any group. It's the highest dropout rate of any group. So these students are suffering. Not only are they suffering from a mental health condition, but they're suffering educationally, and it's hard for them to attain educational advancement because of a mental health condition that may or may not be diagnosed, or they may not seek treatment. And then 70% of youth in state and local juvenile justice systems have a mental health illness. So that's saying that our youth who may be in such programs such as juvenile justice or in some type of state program, they're suffering from some type of mental illness. It could be depression, it could be anxiety, it could be adjustment disorder, but they are suffering from something. So the YRBS, this is a youth risk behavior survey. It's self-administered in our schools. It is school-based, it's confidential, it's anonymous, and it's conducted by Duval County Public Schools every odd year. So the last time that we surveyed students was in year 2019, and we are looking to survey students this school year, 2021. And the YRBS, it assesses physical activity and dietary behaviors. So it's kind of asking students, what do you do on a daily basis to improve your mental health? What type of physical activity are you involved in? And what are you eating? Because we know that our diet affects our overall, not only our overall health, but it affects our mental health as well. And it really impacts some of those students who may suffer with ADHD. We have to ensure that those students are eating properly in order to better assist them with their diagnosis. It also assesses violence, suicide, and safety behavior. So it's asking, what do you do? Um, what are you doing in your environment? What does it look like? Is it safe? Do you feel safe in school? Do you feel safe in your environment? The third thing that is assessing is alcohol, tobacco, and other drug use. So they want to know, and this is for high school students and it's for middle school students as well. They're asking them, are you engaging in drugs, alcohol, and other drug use? Because we know that it impacts a student's mental health severely when they are utilizing drugs and alcohol or tobacco. And then the last thing that it assesses is sexual behavior. So it's asking them, have you ever been molested as a child? Have you ever been violated as a child? Do you feel safe at school? Have you been violated at school? So the YRBS is very important because it gives us a screenshot of our students and ways that we can better assist them in our department. So in 2019, only 8,617 students were surveyed and completed the survey. So we are looking this school year to reach more students so that we're able to better assist those students and provide adequate services efficiently and effectively. So the YRBS data is categorized according to health zones. So it's asking just to check out where your school is on the health zone infographic. So if you look, you can just see where your child's school is. I have Douglas Anderson circled because it's in the 32207 area code. I just chose it. And what we're going to do is look at Douglas Anderson in comparison to not only just our school district, but the state of Florida overall, and I think the country as well. And we'll see those on the next slide. So I'll just be using comparative data in the next few slides. So if you would just look, just see where your child's school may be located in the health zone that they're located in. All right, so this next slide says, how does your health zone stack up? So we looked at safety and bullying. So according to Health Zone 2, which is the health zone that I decided to use, at least 24.4% of students said they don't go to school because they feel unsafe on their way to school or at school. And that data is compared to all of Duval County, which was at 21.8%. So in Health Zone 2, that's fairly high as it relates to students feeling unsafe and not going to school. And then when you look at Duval County in comparison to all of Florida students said that it's just 14.6% of students are saying that they feel unsafe. So in Duval County, we might have had an issue with bullying in 2019, but we no longer have that issue anymore. Um, and I'll get into that as well. I believe Ashley dropped some documents in the chat box, and on those documents are is a bullying campaign. So every October we ensure that we bring awareness to bully prevention. Bullying is there is zero tolerance for bullying here at Duval County Public Schools. So we really ensure that we push the issue of bullying and we talk about the issue of bullying in our schools to our students, and we're also training teachers and staff on how to recognize bullying within our schools. So this is some more comparative data. In Health Zone 2, 18% of students said that they were bullied on school property in comparison to Duval County at 17.5%, and then all of Florida at 14.9%. Depression and suicide. So we know that suicide continues to rise in our population, in our youth. And at Duval County Public Schools, we have, and in the school behavior health department, we have not only have bullying, we have crisis prevention. So we have a crisis hotline. So what happens is if a student is feeling suicidal, they will call a crisis hotline, and they call the number, and then immediately a someone from um, the name just slipped me. You guys forgive me. A therapist will go out immediately and see those students at that school if they are threatening suicide or they feel suicidal. So this is the data for depression and suicide. So at least 27% of females in Duval County have contemplated suicide, and at least 17% of males have contemplated suicide. So this is the data as it relates to suicide and depression. So at least 41.7% of students in Duval County reported being depressed. And then 22% said that they seriously considered suicide. So they might have thought about it. They thought about it. It's not saying that they moved forward or made a plan. They just thought about it. And that is why we have the crisis hotline for students who not only think about it, but make a plan or attempt suicide. At least 19.5% of students made a plan to die by suicide, and then 19.9% of students attempted suicide. So we take suicide very seriously, which is why we ensure that we have all of these programs in place um, as it relates to full service schools therapy and the crisis hotline so that we can ensure that our students are safe and have all of the support and resources that they need. So, suicide is the second leading cause of death for young people ages 15 through 19. That's just a fact. That's a fact. That's a fact. And that is why it's so important at DCPS that we address suicidality, that we address it by bringing in NAMI, by bringing in different supports so that students know where to turn to when they may be feeling suicidal or just have, some thoughts or they're just depressed. So we ensure that students have what they need and all of the resources that they need, and they are housed at each and every school. So let's reframe our data. As I said before, 1 in 5 students, school-age youth, have a mental health illness. So what that's saying is 4 in 5 school-age youth don't have a mental health illness. So we're not saying that all students suffer. We're just saying that it may be 1 in 5. It may be one in your student's class, or it may not. So that is why because we don't know, we make sure that we put adequate supports in place just in case. Even if a student may be having a mental health challenge. So the difference is we all have challenge days where we may feel depressed for that day or sad for that day. We ensure that students have resources to turn to when they may be having a mental health challenge. And a challenge can last from one day up until a couple days. It's not saying that that student is has a mental health illness. They're just suffering with a mental health challenge based on life circumstances or adjustment and things that may have happened um, to them at a specific time in their life. It's not saying that it's going to be always. It's just temporary. So these are some suicide warning signs and what to look for in your student. So these signs may mean someone is at risk for suicide. The risk is greater if her behavior is new or has increased, and if it seems related to a painful event, loss, or change. So these are just some examples. As you see on the screen, a child may be talking about wanting to die or to kill themselves. They may start using alcohol or drugs. They may be acting anxious or agitated or behaving recklessly. They could be looking for a way to kill themselves, such as searching online or buying a gun. They might talk about it. They may sleep a lot or feel isolated. They're withdrawing. Now, we know teenagers at a certain age, they do isolate themselves and they do withdraw. But if it's something that is consistent for a long period of time, we may want to get that child seen. We may want to ask some questions. That's not saying that they're thinking about suicide, but it could be depression. And sometimes depression leads to suicide. So we want to make sure that we're keeping our good eye on our students. Um, Students may be talking about feeling trapped or in unbearable pain. They may show rage or talking about seeking revenge. They could be displaying extreme mood swings or talking about being a burden to others. So these are just some signs. It's not saying that just because your child is doing that that they may be suicidal, but if they have at least 3 of these warning signs, that may be a red flag to get your students some help. Now, what mental health conditions affect students here at Duval County? So, as I stated before, ADHD, those are some of those conduct disorders. ADHD, attention deficit hyperactivity disorder, that really affects a lot of our students at Duval County Public Schools. Anxiety disorders, where they feel extreme agitation or stress. Depression. Now, depression, that's a big one because when a student starts to hit like 7th and 8th grade, we know that hormones play a large part in depression. That's not saying that that student will be depressed for a lifetime. It's just saying that that student may have been depressed during a period of time. So it does affect our students. Depression does affect our students. So just keep an eye out on your child. Disruptive behavior disorder. So that is oppositional defiant disorder where a child just will not follow directions. They will not stay on task. So these are some of our students who are interrupting the classroom. And as we know, those students may not be getting the attention that they want to get at home. So they bring it to school. So we know that mental health is tied not only to school, but at home as well. So we just have to be mindful of the way that we are handling our students. Developmental disorders, that is a mental health condition as well. Eating disorder, so we're talking about anemia or bulimia, and then learning and communication disorders. All of these things affect our students here at Duval County Public Schools, which is why we have so many supports in place for them. Now, What to look for, what you can look for as a parent, what you can look for as a parent if you believe your child may be suffering with a mental health illness. The child may have confused thinking. They may have long lasting sadness or irritability. So they may be very just sad and irritable. So if you see your child just sitting in a dark room for hours and hours and days at a time, that may be a red flag that they may need some additional help. Extremely high and low moods. So they may feel good and then they may feel bad. Now, as I stated, our young children, they have hormones and different things going on. So as I always refer people back to, because I'm a mental health clinician, so I always refer parents back to their PCP, just to kind of get some testing done before making the decision, to say, okay, my child has a mental health disorder. If your child has excessive fear, worry, or anxiety, the child may be socially withdrawn. So if you notice, hey, my child has absolutely no friends, that may be an issue. Dramatic changes in eating or sleeping habits. So if they're not eating or they're eating too much, or you see that they are not sleeping at all, or they're sleeping way too much, that may be an issue. Strong feelings of anger. That child has feelings of anger. And when I say anger, that is um, just lack of self control, where they just cannot control their anger. That child may have delusions or hallucinations. They may see things or hear things that are not there. They have increasing inability to cope with daily problems and activities. So if you see that your child just cannot do it, they just can't. They can't engage in sports and activities. They can't complete their homework. That may be more than them just being, a teenager where they just don't feel like doing it. They may be suffering from a mental health diagnosis or a mental health challenge. So we don't want to be so quick to say, my child has a diagnosis. We want to make sure that we're getting children the help that they need. Now, the child may have denial of obvious problems. They may have many unexplained physical problems. So they're saying, my back hurt, my leg hurt, my stomach hurt. Now, anxiety, I see that a lot, or I saw that a lot as a therapist within the schools. A child comes every day and says, my stomach is hurting. That is a telltale sign that that child may be suffering from anxiety and may need to speak to someone. Not saying that they need psychotropic medicine, it's just saying that, I might need to get my child some additional help. And there are things that we can do as parents to make sure that we give, or that we're providing our child um, with some of the things that they need outside of therapy, such as getting them involved in activities and um, engaging in yoga, just different things that we can do as parents to make sure that our students are well, physically, emotionally, and mentally. If you see your child abusing drugs and alcohol, I always tell parents, get your child some help, because the child is too young. The child is too young to, that affects their development cognitively, emotionally, and you want to make sure that that child gets help. And then thoughts of suicide. If that child says, mom, dad, I just don't feel well, I feel like I don't want to be here anymore, you may want to get that child some help. Now, what can you do? As I stated, talk to your child. You want to ask open ended questions with a neutral tone. You want to say, hey, what's going on? That's my question. What's going on? Because sometimes children, they may say nothing. And then, of course, you want to make sure you help them feel understood by summarizing what they have told you. Make sure. So if your child says, mom, dad, I just feel like Susie Salzbacher doesn't want to play with me anymore. So then you just want to know why, and then they'll tell you why, um, and make them feel heard. You want to make them feel like they matter. Make sure you talk with the teacher or the school as well. So send an email or go up to the school, because the school always has supports. Don't let the schools tell you that they don't. They do. They have a lot of resources in place, which is why our department is here. You want to talk with your pediatrician. So as I stated, if you notice some of these things going on with your child, talk to your pediatrician first, just to get that child tested. Just I always recommend just some blood work, just to see, where that child may be, because it may not be a mental health illness. It may just be some changes within them. And then if you feel like, they, my child could utilize some services, get a referral to see a mental health specialist. And we have those in schools, and you can also refer them to, people within the community as well. So the big question is, how do I know if my child's problems are serious? So, as I stated, they have problems across a variety of settings. So, if they're having issues at school, at home, or with peers, that's a telltale sign. If they have changes in their appetite or sleep, if they feel fearful, if those behaviors are just more common all the time, like with young children, they have bedwetting for a long time. If they have signs of being upset, such as sadness or tearfulness, if they have signs of self injurious behaviors, that's cutting or head banging or hitting themselves, or they have a tendency to get hurt often, and then if they have repeated thoughts of death. So the key thing is talk to your child, know your child, ask questions every day. Ensure your child's well being. Another question is, can symptoms be caused by a death in the family, illness in a parent, family financial problems, divorce, or other events? So we know that every member of a family is affected by tragedy or extreme stress, even the youngest child. It's normal for stress to cause a child to be upset. If it takes more than 3 months for your child to get used to a situation, or if your child has a severe reaction, you want to talk to your child's doctor. You want to reach out to someone if those issues or symptoms last for more than 3 months. Because it is a change, it's a change in everything. And it affects our mental health. It affects all of us differently. So you as an adult may feel this way, but then the child may feel another way. So you just need to talk to your children. Protective factors. You want to work on your mental fitness in these easy ways. Coping skills. So, developing coping skills. We know as adults, stress is super common and a normal part of our lives. So, coping skills help us get through what you go through. So, whatever that may mean, activities with your child, if your child likes to read, if they like music, if they like sports, if they like dance, if they like just anything, just help them dig into their coping skills. Help them so that they can grow through what they're going through at that time, because we know that school is tough. It's tough, not just for teenagers, but for young children as well. I like to say that, you know, they get a new teacher. Children, they deal with a lot of changes because they get a new teacher every year. That impacts them in many ways. I think we don't think about that as parents. So it's almost like grief and loss, because you're leaving one teacher and you're moving and going to another teacher. And then you miss the old teacher, and then you keep matriculating, and then you may not ever see teachers again. So we want to make sure that our children are coping adequately and efficiently. We also want to make sure that our children have positive adults. So they might not always seem like the coolest people to hang out with, but research shows that having one positive adult in your life decreases your likelihood of developing a mental health challenge. So just one positive adult. I see a lot of students in Big Brothers Big Sisters. They're in Team Up. They're in a lot of different organizations at school. So just different things that your child does, just ensuring that they have one positive adult in their life, whether it be in school or in your community. And then positive friends. So you want to encourage your child to have positive friends. Friends can be very powerful in helping us grow through what we go through. Hang out with people who make you feel good about yourself. You want to make sure that your child is hanging with the most positive people. Now, I know as parents, we can't control everyone that our child hangs out with, but as long as you make the effort, and make sure that you're um, just kind of seeing, paying attention to who your children are talking about when they come home, or you're paying attention to their phone and different things like that, because you want to encourage your child to have positive friends. And then, as I stated, this is how we address mental health. We have our crisis hotline, which is supported by Child Guidance Rapid Response Team. I couldn't remember earlier. It's supported by Child Guidance Rapid Response Team, and they come right out and they assess your child if needed, and then they will provide adequate supports moving forward. We also have the bullying hotline. So if a child is being bullied, this is the hotline, and I have numbers if you guys want to screenshot or take a picture of it. We also have universal social emotional screening grades 3, 6, and 9, and we are actually in that screening window right now. It's called the Behavior Intervention Monitoring and Assessment System. And what that is a survey of about 32 questions. And it's asking children basic questions. How do you feel um, at school? Or do you have friends? Do you have positive supports? And the social emotional screening is only given to third, sixth, and ninth graders. We've already screened our ninth graders. Now we're in the process of screening our sixth graders for the next 2 weeks. And then in the weeks following that, it will be our third graders. And third grade is teacher report only. So teachers are giving their insight into what they see and the behaviors that they see in your child if you have an elementary age student. And then we also have access to mental health therapy through full service schools, which every school has a mental health therapist. Every school has it. They have access. We have mental health curriculum, grades 6 through 12. And we also have social emotional learning curriculum, grades K through 5. But this year, we have social emotional learning curriculum across the district. So we have Calm Classroom, which is a mindfulness, and it's conducted by our teachers. We have other mindfulness programs as well in our 6th through 12th grade classrooms. We have Wellness Wednesday, which is our mental health curriculum, grades 6 through 12, and grades 3, excuse me, K through 5 has it as well. And they are meant to empower students, just give them an extra boost of mental health and what it is and ways to cope. So, this is how DCPS addresses mental health in a nutshell. And that is it. Um, I believe that I believe that Ashley has dropped a lot of documents, a lot of goodies in the chat box, so that you can see. I believe it's our bullying prevention flyer. We have our local and national resource list, where students can tag in for supports. We have youth mental health first aid. It's a flyer that I gave to you guys. This is how we train our teachers in recognizing youth mental health first aid. We have our mental health badge. Every student will receive a badge, and it's okay not to be okay badge. And we're encouraging them to be a change agent for mental health with the mental health badge. And on the back of the badge is the list of national and local resources. And then lastly, we have our school behavior health flyer, and this is all of the services provided by DCPS School Behavior Health. Let me turn back on my camera. So I have provided you with all of this information. Please feel free to reach out to us. Do not hesitate to utilize the services that we have in our classroom for our students. I thank you all for having me tonight, and I hope you all have a blessed night.